Hey everyone, it's Dale Walker here, and welcome to another edition of the Correcticise Total Body Renovation mini training. We are on lesson number 9, which is the Walker Method Part 2. And I'm excited to share this with you because it's going to go over kind of some of the things that we did and hopefully start to put things together for you in a bit of a clinical picture that will give you an idea of maybe what's going on in your body and what you're going to need in order to optimize your health, wellness, and well-being. So I'm going to go ahead and start sharing my screen and go ahead and get started with lesson number 9, which is our mini training, which is the Walker Method Part 2. And again, many of you already know, but I am Dale Walker. I am a licensed physical therapist. I have additional degrees as well as physical therapy in cardiac rehab, exercise science, and fitness. So you can find out more about me and my work at fixyouonline.com. On YouTube, it's Fix You Online TV, which we're streaming live right now, and the Facebook group is Fix You Online. So without further ado, I'll go ahead and get started. So we talked about the Walker Method, and it consists of 3 things: release, realign, and reinforce. And yesterday we spent a lot of time talking about release. I demonstrated some release techniques, and today we're going to focus more on the last 2 steps, which is realign and reinforce. But release is so important. I'm going to emphasize it again today, but traditional programs and traditional modalities do not address release. And if you are not releasing, you cannot, in my professional opinion, realign and reinforce properly. It has to be specific. The only case that I would say that this would apply where it does work would be braces on the teeth. And I have to say it's very specific because you are on each tooth, but you are realigning with follow-up appointments for on average. So that would be the only way that I would say that you can get away with realignment without releasing, although I would emphasize too, or hypothesize that if you went ahead and mobilized the teeth, which is connective tissue as well as the gums, you could probably realign with braces, traditional braces, more, and that's braces for your teeth, more effectively and more quickly. All right, so going on, I've mentioned before, the goal is always to restore alignment, optimal alignment, because it dictates function, frequency, and flow. And we've gone over that a couple of times already. Next, we can't achieve ideal alignment without release because, again, the connective tissues are, and joints can be very, very tiny, right? And our releasing tool is oftentimes too big for that specific joint or that specific connective tissue. So again, the smaller the releasing tool, the more specific. That's why in the comprehensive core, we went to the appropriate depth and direction of the restricted connective tissue. That is the superior technique that will allow for greater carryover and a release that is quicker than traditional release. So you don't have to spend many minutes or hours on a particular area achieving release. Now, again, release needs to be performed in order to achieve proper alignment. And these are the techniques that I went over yesterday was the comprehensive core release. And again, that took about 10 seconds. And rotational release is something I'm not going to demonstrate, but rotational release, what makes that different than the comprehensive core is it addresses rotation. So, no kidding. But why is rotation important? Because we are not functioning like robots, right? We have rotation in our movements. And what's interesting about core muscles is that core muscles, all of them their action is rotation, and they are diagonally oriented in our skeleton typically. So rotation is going to be important for that three-dimensional movement that is so important in our activities of daily living, sports, and everything else that we do as human beings. So how do we align non-invasively? So I have here, remember your ABCs. So first is awareness. You need to have body awareness of how your body is aligned. And that's why mirrors are really great to give you some reinforcement, because very few of us have great body awareness. But then it's really the awareness of knowing the way to realign and what that feels like. So where you're bearing weight in your body, how does that look in the mirror? How do you hold yourself? And how do you actually move properly? Because as I've learned, and I was not even aware recently, but there's a proper way to, an optimal way, I shouldn't say proper, but it is optimal, an optimal way to breathe and walk and sit and, thank you, and go ahead and sit and move about in our daily lives with an awareness of how to do this ideally and properly. And then we have bracing, taping, and orthotics. So those are non-invasive ways to do this. I'll talk a little bit more about those in the next few slides. Again, we talked about core contraction, and that needs to happen prior to our moving muscles moving, because that is protective to our joints. And lastly, we have shoe modification, which is another way that you can align. Now, what are the ways to align that? Here are some of the challenges that are associated with that. So again, as I mentioned, you need to understand what to be aware of. And bracing and orthotics are not specific. They do not address the underlying cause, and they can be costly. Taping, on the other hand, is specific. In many cases, it will address the underlying cause if you do my programs. And it is not terribly costly. A roll of tape is about $20. But taping, the challenge to taping is that it requires training, and it will require more time than bracing or orthotics, right? Because the orthotics and bracing can be donned or put on in a quicker amount of time. Core recruitment, it requires knowledge and also training. And then shoe modification, it doesn't address necessarily the underlying cause. It can be fairly specific, but it can also be very costly. So if you've ever had custom made shoes or, quote unquote, orthopedic shoes, or shoes that are designed to help you with walking and functioning without pain, they can in fact be fairly costly. So again, I emphasize enough that none of the above are optimally effective without release, okay? So unless you are releasing so that you can then put the system into the proper alignment, it is not going to be as effective. It may help, but it is not going to be ideal or optimal. So invasively, that's surgery. Okay, and in this case, these are little hairline fractures here. And so this is how surgeons go ahead and correct different kinds of malalignments from fractures. And that, here are the pros and cons of surgery. So one, it's a quick fix for trauma. So if you do have multiple breaks, going ahead and doing hardware, putting in hardware to align, would be a good way to fixate, right, those types of fractures versus just setting a bone. Sometimes setting a bone is appropriate, and then other times the hardware is more appropriate for that particular trauma. It may help with pain relief. So fusion surgeries for the back, for example. The problem with the fusion surgery is that it creates immobility. And then when you're immobile at a certain segment, your body has to compensate by using the other segments more frequently, or they need to have range of motion beyond their normal because you're impeding from the fusion the range of motion at that particular segment or segments. So those other areas will then become what we call hypermobile, and it is hypermobility that tends to lead to pain. So that's where our core muscles are our natural stabilizers. They are our natural fusion, right, in the body. And then also it may improve aesthetics. So foot surgeries, for example, bunion surgeries, hammer toe surgeries, they'll straighten the alignment, but they will not address the underlying cause, and they will impede function for the same reason that I just mentioned earlier, because you will lack your range of motion that's available to you in that particular area. It just, sometimes when I talk, it brings me back to a patient, and I did have a patient who had neurological tone that clawed his foot and again rendered him unable to function properly. And the surgeon went in and he literally fused all his toes that were straight, but the neurological tone was so strong that it actually undid the surgery. So there are failures in surgery, in certain instances, and that is one of the downsides or the cons. And another one, and this is a big one, is that medical errors are the third leading cause of death in the United States, and it totals, the numbers vary, but this was a good resource, which was Johns Hopkins Medical Center back in 2016, estimated that at least 250,000 people die per year because of medical errors. And this is one of the reasons why I'm passionate about creating programs that empower people to take control of their health and healing and give the power of healing back into their hands, because I have lost patients due to medical errors. I've lost people that I care about due to medical errors. And I was also I don't want to say victim, but I was a victim of a medical error that could have certainly, killed me slowly. Not quickly, thankfully, otherwise I wouldn't be here, but definitely could have killed me slowly. And so my goal is for as many people as possible to avoid having to go that route with medications and surgery. And that is why I have developed the programs, the online programs, and the DIY community for empowering people to heal themselves. The second con of surgery is that it doesn't release the connective tissue or address the underlying cause of pain, injury that is due to, or the misalignment, okay, that's due to the misalignment or causes the misalignment. And as a result, something like bunion surgeries, for example, have about a 5 to 10% failure rate because the underlying cause is not addressed. And while again, it will improve aesthetics for a period of time, it is going to impede upon functionality of the body. So anytime that you're considering surgery that involves hardware, I would very much keep this in mind, that as a consideration for that choice, as well as doing your research on it. And then also, unless the hardware is removed or combined with release, motion and function will be negatively affected. And again, if a segment is fused, it is going to be negatively affected. However, we can restore better range of motion in the areas around it and distribute those forces for the range of motions with release. So the next step of the Walker method is reinforce or rebalance. And again, what do you need to do to reinforce or rebalance? Obviously, you need to align. Because of the belly-tension ratio, if you're in the ideal alignment, that's half the battle, or at least I'm going to say 80% of the battle. And the next is proper movement or awareness through movement. And that involves core recruitment. And then again, specific ways in which to move, to hold yourself, to breathe, to sit, to sleep, to vacuum, to open doors, to doing all of the activities that you need to do in your daily life, so that you're reinforcing the realignment, right? And then also rebalancing the system and not causing the wear and tear that activities will cause. The last thing is specificity of training. So if you, again, want to get better at, in this example, soccer, the best thing that you can do is play soccer. If you want to improve your vestibular system, the best way to do that is vestibular exercises or activities, as well as realigning the base of support of the sensory organs of the vestibular system, which is the inner ear. And that would involve release and realignment of the cranium. And then, again, holding your body in the proper alignment through awareness so that the senses such as vision, we talked about peripheral vision being affected, as well as the vestibular system and other sensory organs being able to function optimally because of, right, alignment dictates function, frequency, and flow. So to be truly fit, we talked about fitness at the very beginning, you need to have cardiovascular fitness, and alignment will help decrease the wear and tear when you're doing cardiovascular fitness, because regardless of the activity that you're doing, even if you're doing a recumbent bicycle, to achieve cardiovascular fitness, you need to use large muscle groups over a period of time. So again, the standard is about 20 minutes a day. Although we talked about HIIT training, and again, HIIT training is going to be decreased amount of time. That's only 3 minutes a week. However, it is high intensity, and that would need absolutely 100% to be cleared by your doctor that that is safe for you to perform. But that is a way to decrease the wear and tear. The other way is alignment. Core muscle strengthening. So alignment engages the core muscle activity because of the length tension ratio, stating that a muscle will contract with greatest strength or vigor when it's at a particular length. So this brings me back to another story. My mentors, my physical therapy mentors who I worked with were the PTs for Joe Montana. He played for the 49ers. He was a quarterback many, many years ago, probably in the 80s, maybe early 90s. And he had some serious back issues. And as a quarterback, you don't know where you're going to get hit or when you're going to get hit. And so although these muscles could be strengthened, if they're in the proper alignment, they engage automatically. So that's what he was taught to do, rather than consciously think about core muscles activating to stabilize him. He was taught how to align, and then given the body, most importantly through release, given the body that was able to align, and perhaps, and I don't know this factor or not, but perhaps given bracing or taping that would reinforce that during the game and during his daily life. Because once you're in the proper alignment to learn a new muscular pattern, it takes about I think it's 1 million repetitions. Okay, so if it's breathing, that's pretty easy to achieve. Or if it's walking, same kind of thing, 10,000 steps a day. It's going to take you probably about a month or so to go ahead and reinforce that. So the taping or bracing can help kind of tell the brain how to align properly. And that's why I really particularly love taping, because it is specific, it's not that expensive, and it will go ahead and reinforce without necessarily conscious thought, so that there is a activation of the neuromuscular system allowing you to do that. Flexibility, so alignment will allow for proper active stretching. Remember, passive stretching is dangerous, right? It can actually impede performance and cause injury, because we're going against gravity, we're not having control, and we're not certain what restrictions are going on in our body that might be causing excessive mobility elsewhere. So again, if we have a restriction that we have not released, what will happen is that it's like a fusion at a micro level. Okay, so the fusion stops the motion. Same thing with a restriction, it will impede motion. So achieving motion because the body will do whatever it takes to achieve a task, will be compensated for by other parts of the body, and then they will become excessively mobile and perhaps injured. So active stretching is going to be the safest and most appropriate to help with flexibility, as well as you need to have stability in order to have mobility. So the more core muscle activation that you will have, again, which helps, which is dictated or enabled by alignment, will help with your flexibility. And that's why a modality like Pilates is so effective, because it is core muscle activation, which actually allows the moving muscles to do their job in a protective manner. And it does so with the resistance from the springs. And then lastly, sensory fitness. So again, this is the area that I think is most overlooked in rehabilitation, in fitness, in exercise. And the alignment allows for our senses to work properly because of function, frequency, and flow. So again, alignment dictates function because of the length tension ratio, because of the series of tubes and wires in our body, and then the frequency of our energy will be dictated by alignment. So again, the sensory fitness, we've gone through this, proprioception, vestibular training, and balance, all super important with regard to alignment. And so how do you achieve proper alignment? So if I have not emphasized this is enough, it's release. First, you have to get the segments moving so that they can be put in the proper alignment. Then you need to know how to align and then reinforce it. So again, you can do these things in a variety of ways, but each one is optimally achieved when it is done specifically. So release is optimally achieved quickly when it is a smaller releasing tool. It is specific to the particular direction and location of the restriction. The realignment is more specific when it is one aligning device at one particular area. So that's what, for non-invasive, I think taping is the way to go. And then reinforcement, again, when you want to get better at something, you need to do that particular activity, or the aspects of that activity, breaking down it biomechanically and then from a sensory standpoint to know what's involved with that particular activity and break it down into its components. So as I said before, specificity is superior in all aspects of the Walker method or any kind of treatment modality that you will go through. All right, so with that, I will stop sharing and I will see if there are any questions on the Walker method part 2, part go. And also just see what's going on over at YouTube and see if there are any questions there. And then I will go ahead and prepare for tomorrow's lecture, 5 p.m., live at 5. We will go ahead and go through resilience. And I would say when we're looking at fitness over 40, resilience is going to be key, because that is when our body starts to, that's when research is showing that the important aspects of our fitness begin to diminish. So anytime anybody is over 40, resilience is going to be key to prevent injury and also be resilient to disease and trauma. So tomorrow we'll talk about resilience, and I will go ahead and bid you good night if there are no other questions. Okay, well, thank you for watching, and I will see you tomorrow. Ciao.